Hello. Thank you for choosing our clinic for your allergy care. I'm Brianna. You've come to our clinic to begin your treatment of allergy shots, also known as immunotherapy. This is one of the methods that you and your doctor have chosen as a treatment for your allergies. There is some information that we feel is very important for you to understand as you begin this form of treatment. Your doctor has prescribed a series of solutions formulated especially for you according to the allergens that you are allergic to. Those solutions have been prepared in our own bottle lab. Depending on the number of proteins that you are allergic to, you will be receiving between 1 to 4 injections. After each injection, you are required to wait 30 minutes. Our clinic has walk-in hours. Please observe the schedule. The treatment will typically take 3 to 5 years. It is divided into the building phase, which takes approximately 6 months, and the maintenance phase that will take up the remainder of your treatment. During the building phase, we encourage you to come in every other day during business hours, but not on back-to-back days. Once you have reached maintenance, we will ask you to come in every 2 to 4 weeks, as directed by your shot clinic staff. Remember, you are required to wait 30 minutes after your injection. Your doctor will periodically reevaluate your condition based on how well you tolerate exposure to the things you're allergic to the dose of your serum, and the length of time you have been on immunotherapy. Please, don't be discouraged if you don't notice immediate benefit from your shots. Some people feel relief sooner than others, so it is important that you remain patient during your treatment. It is important that you take your pre-treatment regimen as directed by your provider, since you will be receiving the very substance that you are allergic to. It is possible that you will experience an adverse reaction. The most common reactions occur at the site of the injection. They are lumps, bumps, swelling, or a reddened area that could be itchy. If you notice any of these reactions, please show the shot clinic staff so the reaction can be evaluated and noted in your chart. Any dosage adjustment necessary will be made at the next visit. If you notice a reaction after you have left the clinic, please document it and share it with the shot clinic staff prior to your next injection when they ask you about your last shot. For example, your response might be that my left arm had a lump the size of a quarter and it lasted about 4 hours. This is very important information. If your arm is uncomfortable, we can apply anti-itch gel and ice to the injection area. The other type of reaction is a systemic reaction, which is any reaction that occurs away from the site of your injection. This is more serious and requires assistance from medical personnel. Systemic reactions rarely occur. However, we feel it is very important that you are familiar with the symptoms and that you know what to do. The most serious systemic reaction usually occurs within the first 30 minutes, but can also happen after this time frame. A systemic reaction can occur anytime during your treatment. Systemic reactions can involve any of these symptoms: breathing difficulties, shortness of breath, tightness in the chest, or wheezing, trouble swallowing, itching of the palm of the hands or the bottoms of the feet, sudden onset watery, itchy eyes, swelling anywhere, especially of the eyes, nose, lips, tongue, or throat. Itching or hives anywhere on the body. Postnasal drip, coughing. Sudden severe abdominal discomfort. If you feel any of these symptoms, please notify a staff member immediately so you can be treated appropriately. If you have already left the office when you notice these symptoms, we ask that you return to the office or go to the nearest urgent care or emergency facility and tell them that you had just received an allergy injection. You may be given a prescription for an EpiPen. Also, you may be given additional informational handouts by your provider. There are some important precautions that we want to review with you. If you feel that you are coming down with an illness, such as the flu, a cold, or an infection of any kind, it is not advisable to receive your injection. However, if you've been ill but have been getting better for the last 48 hours, a shot may be given. If you notice increased asthma or allergy symptoms after your last injection, we may determine to either repeat the previous dose or not administer the dose at all that day. Don't be discouraged if this happens. We want to make this treatment as safe as possible. Another precaution is that we ask you to refrain from strenuous activity 1 to 2 hours before and 1 to 2 hours after your injections. These increased activities could cause the serum to be absorbed in your system faster than normal. If you have any changes in medications or new medical conditions, including pregnancy or any emergency medical visits of any kind, please inform your provider immediately. Each time that you come in, we will ask you to identify your name and date of birth on the label of each bottle before your injections. If your child is receiving injections, make sure that you tell them that it is okay to tell the shot clinic staff, "These are not my bottles." Sometimes children are afraid to question authority, so it is very important advice for your child.
This is not my bottle.
If you are taking a class of medication known as beta blockers, you must let your provider and the shot clinic staff know. These medications are commonly used to treat high blood pressure, heart disease, and migraine headaches. One brand name, for instance, is metoprolol. If you have glaucoma, some eye drops used in treatment contain beta blockers. Please bring any additional questions or concerns to your provider or their medical staff. We are excited to walk alongside you as you begin your allergy treatment with us. Have a great day.